Hey beauties, and welcome back to Aesthetic Chat with Kiki, Season 4. I'm so excited to announce this next guest. She has been on the podcast. It is Jennifer Prince. So I'm so excited for her to share all the knowledge that she learned since we chatted last, because now she is a nurse practitioner. Well, welcome back to the podcast, Jennifer. It seems very full circle since the last time we chatted. You were starting NP school, and here we are. You're finished and back to, everyday life. So welcome back.
Thanks for having me. Yeah, I think I'm excited to be able to talk about everything I've learned and the growth that I've had over the past year and a half now, I guess.
Go ahead and introduce yourself for those who might not know who you are, and then tell us where you attended school and then when you graduated.
So my name is Jennifer Prince. I am a now certified family nurse practitioner. I live in Scottsdale, Arizona, where I own my own practice called Institute of Aesthetics, Beauty, and Wellness. I've had my own practice for 6 years, and I've been in the industry over 15. So long time. I attended Vanderbilt University's family nurse practitioner program. It is an accelerated program that is 11 and a half months. So it is the quickest nurse practitioner program that you can do in the country.
So it sounds like it's very, very full time if it's done in 11 and a half months. Walk us through the fact that you are a business owner, have a life outside of school. What was your biggest challenge doing a program in 11 and a half months?
Yeah, I mean, here's the thing. I had wanted to do NP school for many, many years, but my girls I have 2 daughters, 18 and 21 now. So they're both in college. I had wanted to do an NP program for years. However, all of the ones that are located in the state of Arizona, like ASU or Grand Canyon or some of the other online programs, are part-time programs, and they're almost 3 years. So most of them are somewhere between 2.5 to 3 year programs. And so for me, I never could commit that much time. So the reason why I chose Vanderbilt's program, I did my undergrad at Vanderbilt originally. I did a nuclear medicine bridge program through them for my first degree before I went into nursing. And so I was familiar with the city, and I was familiar with their academic program. I am one of those people, I want to put my head down and get it done. They do have a part-time 2-year program for those people who are interested. And I did tons of research in the sense that, the main ones I was looking at was, Georgetown University's program, Duke University's program, and Vanderbilt's program. So I could speak to you a little bit about how to get into those programs, because there's a big misconception in the sense that some of the online programs you can apply and you can start whenever and you can work. It's not a rigorous admittance. Vanderbilt is. It's very difficult to get into. And I actually got waitlisted even though I was an alumni.
Yeah, I think that would be great to hear. I guess, how many students are they taking per cohort?
So they have a lot of different programs. So I originally was interested in doing the women's health program because I felt like that was more in line with what my goals were for my practice. However, when I started, they only accepted 15 people into that program, and they really wanted those people to already be working in women's health. And so I was told by my advisor, don't even apply, Jen, you're not going to get into that program. So I applied to the family nurse practitioner program, which they accepted 50. I think we ended up, several people kind of dropped out or ended up transitioning into a part-time program. I think we ended up finishing somewhere in the high 30s or low 40 number.
Gotcha. Yeah, I definitely would love for you to walk through the application process, especially for a program that people are interested in, that is, get in, get out. So yeah, if you could chat about that.
Absolutely. So application, and again, I would check their website. It's very detailed. Somewhere around, it was November 1st or November 15th, you had to have all of your application in. And again, I've had a lot of people reach out and be like, oh, I'm past that deadline. Is that going to affect me? Yes, it's going to affect you because they have thousands of people that apply for the program. And so if you're past that initial review period, you probably won't get in that year. You have to have 2 or 3 letters of recommendation, one of which has to be from a physician. They like to have other applications that are more like character kind of reference letters. So I actually had at the time, my medical director do one for me. And then I had to kind of focus on, because I corporately trained for Allergan and Galderma, I had those directors, me letters of reference. And then I had some of the other NPs that I worked with in my practice. For 5 essays that you had to write, for me, I was like, oh goodness, I'm an aesthetic nurse. So how am I going to show that I could help small town communities? So I had to really pull from my background, coming up from a small town and having had family members that didn't have health insurance and some of that. So I really brought in a lot of my background into it. And then I would say, if you are put on a wait list, don't think that that's a bad thing. In most cases, if you apply and you are put on the wait list, usually if you reapply the following year, you'll get in. I have a lot of friends that have done that. For myself, what I did is I reached out to all of the advisors and the people in the program and said, hey, I'm on the wait list, but I just want you to know, this is my time. I'm dedicated. If you give me this spot, I'm going to be there. I'm going to work hard. So I'm a 100% yes. So if anybody drops out, please think of me. After I did that, within 2 weeks, I got called off the wait list.
Nice. So yeah, one of my questions for you, it sounds like your application process was very similar to mine, where you had a lot of essays and they wanted to know, what are you going to do with your degree and how are you going to impact the community? I personally ended up not saying that I was an aesthetic nurse, and that was what I was using my degree for. I went and pulled back a lot of, the experience I had prior to working in aesthetics. Was that you as well, or did you end up putting in there that you are an aesthetic nurse, you own your own business?
So I did say that I was an aesthetic nurse and that I own my own business. I did, however, and one of the main reasons why I did this program is I have a huge passion for wellness and functional medicine. And so I really discussed that, in that how I wanted to start treating my patients more holistically in what I was currently doing. I wanted to expand that to do, total wellness for my patients. But I agree. I was really on the fence about whether I say I was an aesthetic. So I think if you do say that, you have to say you want more, right? Because if they think you're just in aesthetics, they're going to say, oh, she's just out for money. This is not something that she's going to be serious about. It gives us a negative kind of viewpoint from professors, I think, and which is really sad.
Yeah, I feel like it's still kind of the tune of well, that's not real medicine. You could go back to traditional medicine. So I was going to ask you, were there any other people specializing in aesthetics?
Yeah, there were actually 3 of us. And we bonded immediately. One girl was from California and one other girl was from here in Arizona. And it's so funny. The girl from Arizona, we did not know each other previously. She's in a town that's maybe an hour from me. And so, but we've become best friends. And when you go through something like this, you bond over the intensity of it. And I know you asked me this question and I kind of skipped over it, but I would like to speak to it. So I had to go down to injecting just 2 days a week. How it played out started in August. And so don't let this scare people, because I did it, you guys, and I ended up with a 3.97 GPA. I made 1A minus through the whole program. So it's definitely something that you can do and still be successful in. However, I took 7 classes per semester. So you had the fall semester, the spring semester, and the summer semester. There were 7 classes each semester. The first semester, we took all the 5 Ps. So we were in everything at once, which was super intense, especially because I had not done any kind of online education before, because I'm 45 and that just wasn't something that I had ever done. And so that was the biggest learning curve for me. It was learning out how to use Brightspace and how to do everything virtually. So I went from seeing patients 3 or 4 days a week and then training 1 day a week to just seeing patients 2 days a week. And I worked with medical assistants so that I could increase my patient numbers. So I was seeing anywhere from around 25 patients a day, 2 days a week. So I was still able to see 50 patients a week, which was a lot. And then doing the 3 days of school the first semester. And then in January, you started clinicals. So I was in clinicals 3 days a week, seeing patients 2 days a week. And then the class load went from, I think, 7 to 6. And then in the summertime, same. I was 3 days a week, seeing patients 2 days a week. And I was back up to 6 or 7 classes, but those were the research-based classes. So I was just writing some papers during that time. But all in all, I graduated August 4th and I had started the program, I think August 28th. So it was right at around 11 and a half months. And you have 2 weeks off for winter break. And then you had a week off between spring and summer. So, and I did it. I look back and I'm like, oh my goodness, I don't even know. I don't remember doing that at all, but it's totally doable.
Honestly, so my program is a DNP. It's a 3-year, it's a full-time, and I take 6 classes a semester. And so I wish I would have just done your program, because at least you can get your head down and just do it for 11 months versus consistently being hit every semester with, I'm just counting down per semester versus per month.
Yeah, I know personally, I don't do well with like longer. I'm like a little spurt of energy here. Like that's just my nature. The one thing I do have to say about this program that I did is they allow you to bridge into the DNP. So you can take a year off. And I think you can even defer that year if you need to, once you've already like committed to do the DNP program. That's something that Alicia, my girlfriend who did the program that was here in Arizona with me, we keep going back and forth like, are we going to do it? Are we going to do it? I don't know. Eventually I will get it. I think the future of aesthetic medicine depends on us improving our education, and I'm a huge advocate for it. So I'd love to talk a little bit about, now that I'm on the other side, why I think it's so important for nurses to go back.
For sure. I think first, right before we touch on that aspect of it, I would love for you to just let everyone know which certification exam that you sat for and your thoughts on why you maybe chose one over the other.
Yeah, everybody that I talked to said different things. There was no like clear cut, do this one over this one. The 2 major certifications are the AANP and the AANC. The difference is the AANP, you're going to get FNP-C behind your name. The other one, you're going to get FNP-BC, so board certified versus C certified. It is my understanding that the NP is a little bit more clear cut and diagnosis based, whereas the NC is more theory based. Vanderbilt paid for us to have a data bank called Board Vitals of 1,500 questions, and you could test yourself. And that was so valuable. I went in feeling prepared. Like I graduated August 4th. I studied and took my test September 11th. So I had about 5 weeks of straight studying. That's all I did. It was maybe other people have different visions, but for me, it was the hardest test I've ever taken in my life. It was, I took every minute of that 3 hours and ran out of time. And I felt like I failed it. I really did, but I did pass. So I remember I clicked the button and then they said, you passed. And I'm like, how the heck did I pass this? But oh my God. But I do know other providers that even went through my program that didn't pass the first time. So if you take it and you don't pass, it's not the end of the world. You do have to take 15 hours of continuing education, I think. So you would have to go and do like a weekend course and prove that you did that and submit it. And then you can take it. They give you one more option to take it in that calendar year.
One more question about program specifically. Did you have to find all of your own clinical rotations, and did you end up having some difficulty with that, or was that not too bad?
Yes. So they provide, if you're in Middle Tennessee, they find them for you. If you're outside of Middle Tennessee and you're doing virtual like I was, you find your own. And they do have resources, like they have alumni all over the country that you can reach out to and say, hey, I need help. Or they have people that have gone through the program before that had sites. I was able to find mine just from, people that I've known through the years. There's NPs that have gone before us that you can reach out to. Initially, I had 3 sites set up. A primary care physician that does functional medicine, and he was going to be my first site. And then I was going to go in 200 hours of specialty with a dermatology girlfriend of mine, and then a friend of mine who is an OB-GYN, and do some women's health. So that was going to be how I kind of spread out the whole thing. However, when I got into my first rotation, I loved it so much and I was learning so much that I stayed the whole time. And they allowed me to do that. Because I think sometimes when you go into a place, it takes a few weeks to a month to start getting acclimated and feel comfortable and like find your voice. And then if you're jumping around sites, you're never going to get confident in managing patients.
Nice. And then overall, how helpful did you feel like your faculty was?
Super helpful. Like even so much so that they've reached out to all of us and like, hey, did you pass? How did it go? What's on your agenda for, in the future? So I feel like because the class sizes are so small, you get to know the whole team. Then you go on campus 2 weeks per semester. So you're there 6 times that year, and they're not full weeks. Sometimes they're only like 2 or 3 days to do your clinical checkoffs. They had a team of people that actually taught on themselves, which was so awesome.
Nice. I just didn't realize that there was a commitment to go to campus every semester. So I'm sure that that is a barrier for some people with the program as well.
It might be, if you have a family member, like if you have kids, little kids, and you don't have someone to help you with that. Yeah, I would imagine that would be. I actually liked it because it allowed me to get a relationship with the other people and with the staff members.
Nice. Okay, now transitioning to kind of the topic that you wanted to talk about. So talk about why you ended up obtaining your advanced degree and why you think other nurse injectors should do the same.
I get asked all the time, like, okay, Jen, now that you're on the other side of it, what was the biggest takeaway or like what's the biggest change that you realized that you were not doing in your practice? And I can tell you, as nurses, we're not trained to look in the big picture and to chart it as such. So like a SOAP note in nursing diagnoses is so different than a SOAP note in a medical diagnosis. The first thing that I did is I came back and I said, okay, we are going to revamp all of our policy and procedures. We are going to change up all of the way that we're charting. We are going to make sure that we're implementing good faith exams in every single patient, that we're documenting medical history. And it was just things like for myself, because I had not taken new patients in a long time. It had been like 3 years or 4 years since I had taken new patients. They would come in, we would still, because of our EMR system, making them sign consent each time, we were still consenting them, but I wasn't going back and updating all of their health history each time. I think that we don't know what we don't know. There are so many people that are going to nursing school to do aesthetics, and they're not getting any kind of education in a hospital setting or in a doctor's office setting. So they're really not being taught that bigger picture. And that sets us up for a lot of liability, like a lot of liability. We are doing things that are medical implants. We know that what we're putting in the face can have long-term consequences. There's responsibility associated with that. I hope that if we can get together and empower others to continue on to their education. And I'll speak out to this. Like if you are a dental hygienist or you are a medical assistant that doesn't have any advanced training, like that is scary. Learn as much as you can just to keep yourself from harming others in the future.
Do you recommend, so when you're hiring for your clinic, do you look for people that have had, hospital experience or traditional medicine experience? Just because, at least in my own experience and going back to NP school, I had to go back and tap into a lot of my experiences then, because a lot of the coursework and a lot of the prompts are, in your own experience, explain X. I've talked to a few other nurse injectors who are now in NP school, and the ones that have not done any type of traditional healthcare and went straight into aesthetics have struggled more.
I agree. And in NP school, I pulled, like, even before I got into plastic surgery and aesthetics, like I said, I started my career in nuclear cardiology. And so me just having that basic knowledge of pharmacology and cardiology experience and all the disease processes that go with a cardiology patient, I pulled for a lot from that, more so than I ever did in plastic surgery, dermatology, or aesthetics. So yes, I agree. It's kind of funny how I've changed over the years in like what providers I look for. I used to really look for someone who had experience in nursing, but no experience in aesthetics, because I wanted to have the ability to train them fundamentally from a safe place. Sometimes when people have had lots of other trainings before they come to me, or maybe they're injecting, they can maybe not treat the patient the same way I do. And so if I'm going to have my patients go see another provider in my practice, I want to make sure they're going to get the same results, the same quality of care. I don't have to think about it like, are they good? Are they safe? And so I used to think of it that way. So I wanted to be kind of like their first training program. I still like that, but I do really love having an injector that goes out and works in aesthetics. I love the ones that I train. They go work in aesthetics and then they come back to me. That gives me an opportunity for them to know the grass is not greener. They know how hard it is out there without someone supporting their educational growth. I am very big on personal and professional growth in my practice, and having them feel like they can lean on me and they're safe. And so when you go out there and you're in a med spa environment where you don't have that person, or you don't have anyone, sometimes you can go into a position where you're the only injector and you're a new injector. Like, that is super scary. So as far as like future hires, yeah, I would be looking for someone who has an advanced degree, mainly because the laws are changing. Like, we're seeing them come about. You know, some states, you have to have a medical director on staff to be able to do certain laser procedures or certain aesthetic procedures. You know, there's some states that NPs aren't even allowed to inject. So, you know, I think that we're going to see that in the future, that we're going to see a lot more regulations.
I think you bring up a really great point. There are a lot of places that people can work now. There's a medical spa on every corner. But I've had a handful of people reach out, and, you know, I think it's important for you to say, you know, the grass isn't always greener. But for those new injectors or injectors that are just starting out, there are also a lot of places that are not going to support your growth, and they're not going to be healthy places. So, I mean, if you could chat a little bit about how your business and how you as a business owner run your practice a little bit differently than a practice that is not as supportive.
Sure. I mean, I think the biggest thing that I see is, you know, there's so many injectors out there that'll be like, I've been doing aesthetics for 10 years. Okay, well, why have I never seen you at a conference ever? You know, why have I, like, are you doing any continuing education? Because I can tell you what we're doing this year is totally different than last year and the year before. This industry is growing so fast, and the knowledge, if you're not spending the time furthering your knowledge information, you're going to be left behind and you're going to be dangerous. So I say that in that anyone who is in my practice, that is an injector in my practice, they get continuing education. If I go to a conference, I'm going to pay for them to go to that conference too. You know, I want them to be educated on anatomy, and they even assist me in my new injector trainings because I want them to have the ability to teach, because as we teach, we learn more than we do sometimes learning on our own. I like to be sites for trying new things. They have the ability in-house to learn all of that. I have traveling trainers that come as well. So even though I am a trainer, that doesn't mean I know everything. And I want them to get education from all the different sources. They can then build their own aesthetic vision through, you know, maybe the foundation that I gave them. I used to look at it like, if someone left me in my practice, like, I was very hurt because I'm like, oh my God, they're leaving me. And now I'm almost like, wow, you know, like I was so instrumental in like helping them in their life. And if I can look back and like say God used me as an advocate for them providing for their family, and they were able to grow and go out and be a business owner in their own right, like, that's pretty impactful. I've grown as a business owner in the sense that I don't look at things as like self anymore. If I go down in history as a mentor to other injectors, like I keep track, and like there's over 100 injectors in Arizona that I've trained that are successfully injecting and running businesses, and 100 people. Wow. Like over the country, like thousands. And I'm like, God really gave me a gift, and that's special. That really fills my cup.
I think that's really cool, even listening to you talk about your transformation of you trying to find people that will inject just like you to, actually encouraging them, find different pearls from different people and create kind of your own style, or don't become just like me. Like, I want you to become just like you. So I think that is really, really cool. Kind of the last two questions I have for you. One, I want you to touch on what would be your driving factor for going back for that D&P?
The D&P process is actually twofold. So I was a single mom for a really long time. And like I said, I have an 18-year-old and a 21-year-old, and both of them are going med track. My older daughter is going to be applying for vet school in the spring. And then my younger daughter is pre-med student, and they both want to be physician doctors in their own specialties. So they have made me promise that if they get their degree, that I will as well. That would be like my personal reason for going back, so that we could all achieve that goal together. They were instrumental in me applying and having the confidence to go back to school. But in the future, like if you said, and this changes each time I grow professionally and personally. So you may ask me this next year and I say, I've changed my mind. I am very spiritual, and so I really am always looking for where my path is going to take me. When I'm done injecting and I am older, I will never retire. I will always be doing something. And where could I see myself? And I could see myself in more of an education professor kind of role. Having my D&P would absolutely help me achieve that. If you said, what would be your ultimate goal in life, Jen, in aesthetics? I would love to help start a post-grad aesthetic nursing program at a university and help expand that, a curriculum that we could have to put behind our name to credential ourselves.
That's awesome. It sounds like you need to connect with Haley Wood.
Yeah, it's so funny. I'm actually spending the weekend with her this weekend in Franklin at South Hall. So we're having a little retreat, her and I. Yeah, we definitely are aligned in that goal.
I love that you have, goals, but you're also very, fluid in those goals. What is one of the biggest misconceptions about NP school that you wish you maybe would have known going into school?
That's a hard one. They'll tell you need to go and get a job in a primary care practice as an FNP and work a few years to be able to be competent. And I think if you're going to see chronic disease management, absolutely, I agree with that. However, I think medicine is becoming so specialized anyway that as a new FNP, whatever field you go in, like even if it's not aesthetics, you're going to need mentorship. So even now, I still have mentors I can call and say, hey, do these labs look okay? Like, I don't know. I've never seen this. What do you think about this?
Speaking to the newer injector that wants to open their practice and, they're very green, they're maybe a year into injecting, but, they see everyone else on Instagram. They see the people that have been injecting a long time that then open their practice. What do you say to those people when they think that, owning a medical spa is going to be the best thing ever?
Girl. Okay, so we need a whole episode on this, okay?
We'll have to bring you back then. So give us a little snippet.
Okay, I'm going to tell you guys. I'm super passionate about this. It's a lie. Social media is a lie. People make it look like owning a business is easy. They make it look like having your name on that door is glamorous. And that feeds this little piece of us that's the ego that wants something. And like all of us are creative. We're not in this industry if we're not. So like it feeds into that creative part where you're like, oh, I want to make a brand, and oh, I want to pick out colors, and I want to be a decorator and decorate my practice. And I want to, yes. Okay. However, it is very, very different when you are getting the bills for these things, y'all. And I'm going to get Southern here for a second because I am Southern. Running a business is 24 hours a day, 365 days of never a break. The amount of pressure that I have on my shoulders that I carry every single day. If something goes wrong, I'm that person. If someone is sick and doesn't show up for work, I'm that person. If we have a a pandemic and we're closed and we're not making any money, guess what? I'm still paying the bills. It's truly exhausting. And I don't mean to be Debbie Downer. There are some beautiful things about running your own business, but I can tell you, and I'm open about this, I hate that side of it. I hate managing people. I hate doing administrative work. I am a creative. I am an artist. I want to go in. I want to inject. I want to make people feel beautiful. I want to impact their lives, and I want to leave. And I don't ever get to do that. I would just say before you go out and do that, reach out to other providers that have their own business and ask them if you could pay them for some business education, or if you could shadow their day to day, or if you could have somebody be real with you about it. Because yes, you can make money, but yes, it can also be a financial burden.
Thank you for being honest. I do think that we eventually need to do a full episode, and I need to bring on a bunch of different business owners, because I like that you say, you know, go and talk to one business owner, go and get, you know, other people's opinions on it. My personal opinion is talk to multiple business owners with multiple business models and really pick everyone's brain. It's not about picking out the brand, like you said, or picking out the color scheme. It's so much more. So I'm glad that you touched on that. We'll definitely do some type of something going forward. But lastly, I do want you to share one of your 2024 goals with everyone.
Yes. So 2024 is a year of rebranding and coming into myself. This year is going to be like a holistic, nurturing self-care year for myself. And that consists of me going back to my hobbies and things that I used to love that I didn't have time for when I was in school. Like, I'm excited for this year. I think economy-wise, you know, the economy is not what it was last year or a year before. So I think we're coming into some uncertainties just about, you know, patients are holding onto their money a little bit more. I'm seeing that here in Scottsdale, which is usually one of the last places to see that. If you're a provider, I'm just holding my money a little closer. Like, I'm not going to spend a ton of money on new devices and things in the spring. Just going to kind of wait it out and just invest in myself.
I love it. And so tell everyone where they can find you on social media, where they can find your practice.
Sure. So my personal Instagram is Jennifer Prince Aesthetics, and my business is Institute of Aesthetics on social media or Instagram. And I am located in Central Scottsdale. Our website is instituteofaesthetics.com.
All right, beauties, and that was a wrap on the episode. Thank you again, Jennifer, for your time. I'm really actually excited to bring her back on to talk all things business in the near future. The Instagram is at aesthetic.chatwithkiki. My Instagram is at aestheticnurse.kiki. The website is aestheticnursekiki.com. So until next time, beauties, bye.